So the lumbar spine, or the lower back, is made of these building blocks where you have a bone separated by a cushion. We call that cushion the disc. And then you can see in very close proximity to the disc lie the nerves. So in the middle here we have the spinal cord in blue, and these are the nerve roots. So patients that need a disc replacement will often come to see me with an injury to one of these structures, to one of the discs. And you can imagine if this disc is bulging or pushing back against the nerve, it can cause a lot of nerve issues. And that patient will come in with symptoms like burning pain down the leg. They might say, I have a sciatic nerve problem. Lumbar disc replacement is done with a patient laying on their back in the operating room, and it's done with myself as well as a co-surgeon called a vascular surgeon. These are specialists that are able to get me the view I need of the lumbar spine through a small incision. And because there's important blood vessels that live in this area, we use the expertise of a vascular surgeon to give us a safe approach or safe corridor down to the spine without complications. Once the vascular surgeon has given me the view of the disc, and we're looking at it through a tube, so you can imagine we use a lot of special lighting and magnified vision so we can do all this work through a tube, through a small incision. Once we're docked onto the disc, we then start the process of removing that disc and removing the injured tissue to make more room for the nerves. We want to make sure that pinched nerve is completely decompressed and all that disc material has been taken off, as well as any bone spurs in that area. Once that's accomplished, we then begin the process of determining the best size implant for that patient's anatomy. And that's done using a combination of experience and our direct visualization, as well as live x-rays during the procedure. Once we've found the right size implant, it's then carefully inserted into the spine and secured. One of the advantages of doing a minimally invasive disc replacement and using a vascular surgeon who's skilled at accessing the spine through a tube through a small incision is early mobilization. In other words, the patients are up right away after surgery. So even after having 2 levels replaced, as shown in the model here, these patients can get up and work with physical therapy the same day, and usually this is done on an outpatient basis. We do what's called a 23-hour outpatient stay. So we'll usually observe the patient overnight and they can go home early the next morning.